Welcome, everyone. Thank you for joining us for today's webinar. My name is Ashley Randolph, Mrs. California, United America. This webinar is sponsored by Prolacta Bioscience. Today, we are presenting COVID-19 in the NICU, presented by Deb Discenza, Jenné Johns, and Yamile Jackson. Now, without further ado, I will turn the time over to Deb Discenza.
Thank you, Ashley. We are lucky because we have 4 Preemie Mom leaders, plus 1 incredible audience, plus 1 supportive sponsor, and together, we all thrive. I am honored to introduce Ashley Randolph, our first speaker. Ashley Randolph is the mother of 3 children, all who were born premature. She created Glow Preemies to help support high-risk pregnant women and families with children in the neonatal intensive care unit worldwide. Ashley is most passionate about helping people, especially improving the lives of babies born prematurely in the African American community and providing support and safety net services for their families. She is currently reigning as the 2021 Mrs. California, United America. She is the recipient of the 2017 Presidential Excellence Award for her hard work empowering minority mothers. She is currently working on a research study with the California Perinatal Quality Care Collaborative, CPQCC, based at Stanford Medical School. She's an author of many hospital publications. Ashley?
Thank you, Deb, for the introduction. As a mother of 3 preemies, I understand that you are at a sea of worries. I am also here to tell you that it is also completely normal to have anxiety. The current pandemic of COVID-19 makes it more difficult for families with NICU children to be as supportive as they would like. Parents, organizers, and hospitals are currently working together to keep families safe as well as keep them included in their infants' care. If you are feeling worried and need someone to talk to, feel free to send an email to globepreemies@gmail.com to get resources to help in your area. I would like you to understand your rights. You have the right to know and understand hospital policies, procedures, education, and resources. You have the right to seek support, such as peer-to-peer support programs and other supportive programs. Okay. Need and provide it to your social worker or fees. The experts at CDC and WHO are still doing research on how COVID-19 affects preterm infants. What we do know is there is no mother-to-child transmission of coronavirus during pregnancy, but after a birth, a newborn is susceptible to person-to-person spread. A very small number of babies have tested positive for the virus shortly after birth. However, it is unknown if these babies had the virus before or after the birth. The virus has not been detected in amniotic fluid, breast milk, or other material. If you are currently pregnant and expecting a preterm birth during COVID-19, there is current information for you as well from the CDC and WHO. If you are infected, you may have a greater risk of respiratory complications. If you are a pregnant woman, you are no more susceptible to contracting COVID-19 than a non-pregnant woman. It is normal to feel anxious about breastfeeding during this time. Breast milk still provides protection against many illnesses, best source of nutrition for most infants. If you are sick and choose to direct breastfeed, you should wear a face mask and wash your hands before each feeding. If you are sick and choose to express breast milk, make sure to express the breast milk enough to establish and maintain a milk supply. A dedicated breast pump should be used. To protect yourself from COVID-19, health officials say that you should avoid people who are sick or who have been exposed to the virus. Clean your hands often using soap and water or alcohol-based hand sanitizer. Try to clean and disinfect frequently, touch surfaces daily. And most importantly, wear a mask and practice 6-foot physical distancing. At the time of my birth, I wish I had known that the hospital staff was one of the best resources to have right after giving birth. I would have asked my social workers a list of questions and seen if they could help provide some of the items the babies needed. It was not until after my third birth that I learned of free programs connected to the NICU for diapers, car seats, and cribs. At this time, I would like to now introduce our next speaker. Deb Discenza is a mom to a 30-weeker named Becky, who is now almost 17 years old. From her experience, Deb went on to create the former Preemie magazine and the current entity, PreemieWorld.com. She is a co-author of the forthcoming second edition of the Preemie Parent Survival Guide to the NICU, coming soon in print and ebook.
Thank you, Ashley. Let's talk about advocating in the NICU. It actually starts with postpartum care, actually. I am hearing about many mothers who forego their postpartum checks because they're dealing with the NICU chaos, with pumping breast milk, with siblings, work, everything. Add a pandemic, and I can see why it would be skipped, but it's really important. And here are several reasons why. The OB will check that you're physically healing. There are complications postpartum, so it's important to go get that checked. Also, you can take that time to talk to the doctor about several things, including breastfeeding and pumping. If you're having trouble, she or he can forward you to other resources or maybe help you out through their practice. Also talk about family planning. I know that after I had my daughter Becky, I actually within the first 24 hours was wondering aloud if I could have another preemie. Would it happen again that soon? And many parents follow suit with me in that. The emotion side, you definitely could talk to your OB about it and say that you have concerns because this population has high risk of postpartum depression and PTSD. Let's talk about NICU care. It's a pandemic. You may be limited in visitation or locked out of the NICU right now entirely, but you are still a parent, Be a friend to the nurse and ask him or her for the best time to call in and check for an update. In the update, ask for specific things each time and ask for like weight status, breathing status, medication status, feeding status, or anything else you should know. That nurse will be grateful that you're only asking for specific things and at a specific time. That way they can work around their schedule to help you. But what about bonding? This is a big deal in the NICU, as many of us know, me included. Kangaroo care really helped me, but it took a while to get there. There are many families right now that don't even have that time to do it at all. So if you are able to do kangaroo care, even for a limited amount of time, do it. Yamile will talk about the benefits in a bit. If you don't have the access to kangaroo care, you can still bond with your baby remotely, and you don't have to join a Zoom video to do it. So the key is that your baby knows your voice and is soothed by it. That's a superpower, folks. Ask the nurse about sending in an audio file. It could be of you talking to the baby, singing a lullaby to the baby, reading to the baby. Your voice played several times a day will help soothe your baby and make a big difference. But when it is time, if it's possible, that kangaroo mother care is possible, you want to make sure to ask the team that you can do it because there are great benefits. If not, if it's not doable at all, Yamile will share some great ideas. Knowledge is power. I created Preemie World because I had no resources when my daughter was born. I didn't even get the NICU's welcome packet. I had nothing. And I was frustrated, isolated, and I needed help. I wanted to create that voice in the dark. First up was the Inspire Preemie community, which was created like 15 years ago. And you'll see here 2 flyers, one in English and one in Spanish. They're in the freebies section of the preemieworld.com website. Please feel free to forward them on to other families. I would say that back when we started it, there were only a few of us at that time. We are now, 15 years later, heading straight towards 52,000 parents worldwide. We partnered with Inspire, and we have parents from all over the world in the NICU, out of the NICU, and beyond. And this is a free service, totally free, safe and secure, and gives you control over your privacy. So the Preemie Parent Survival Guide to the NICU was the book that I wanted when I was in the NICU. My co-author, Nicole Kahn, and I both felt that the books that were out there were great, but we wanted something completely different. We wanted something colorful, friendly, full of resources, full of information, healthcare experts, everything, and a bunch of our personal takes on the situations at hand. So we loved it. It was greatly loved. We sold out of our first edition. It was time to update. We recently got it done and got printed, and behind me are 18 boxes filled with books. And so we're about to release that in an ebook. If you're interested in learning more, please contact me. NICU nutrition is a parent superpower. These 2 resources right here are part of that superpower. These help you advocate for your child's nutrition in the NICU. And you're thinking, well, I'm breastfeeding, so that's fine, right? I don't know. Let's see, I was pumping. My daughter was 30 weeks gestation, and the team fortified my breast milk without my permission. Becky got extremely sick, and we almost lost her to sepsis. What were we saying about breastfeeding? Nope, they're going to fortify because they need to give the extra calories to help the baby grow. That's just reality. It is my mission to make sure parents know their options. But fortification happens, and it fortifies usually with a cow-based fortifier or cow-based infant formula. While that's okay for some preemies, it could be deadly for the 1,250 gram and below babies. So ask your doctor about what the baby is being fed. If your baby is under 1,250 grams, there is a better alternative, a 100% human milk-based fortifier. I've actually seen this work in a baby boy named Ethan that was born at 22 weeks. At the very edge of viability. I thought I was planning to go to a funeral, and he started on the 100% human milk fortifier. I will say that he did something amazing. No neck, no sepsis. He just grew, really healthy growth. So instead of planning to go to a funeral, I got Mother's Day pictures, her first Mother's Day last year. That was wonderful. What I wish I had known, that I was still a mom, because I felt like an alien in the NICU. And feeding, it's not about guilt. It's not about who does what better than everybody else. It's about trying. So I always use this hashtag a lot called Just Trying Counts. Milk fortification happens, so advocate for your baby. There are resources to help you do that. Mental health, it's a struggle in the NICU. Get help. It helps you, and it also helps the baby. There's research in that. And parents have superpowers. Our bodies do amazing things for preemies. You matter in the NICU. Thank you. I am honored to introduce you to Yamile Jackson, who will be talking about connecting in the NICU. Yamile Jackson is CEO and founder of Nurtured by Design and is also the mother of a preemie born 12 weeks early. She applied her PhD ergonomic training to design innovative evidence-based technology for premature infants to ensure safety, sleep, development, and quality of life. She will share some of her award-winning technology with you and how during this pandemic, you can continue to connect with your baby. Jenné? Yamile?
Flood in Houston shut down the hospital, including his life support equipment. We kept Zachary alive by touch for 9 hours until he was evacuated. I held him skin to skin, and Larry received a crash course on how to bag him. Then he took turns with the staff. During these dark hours, I promised Zachary that his pain and struggle to survive were not in vain, and that I would dedicate my life to improve the lives of babies like him and families like ours. Zachary's incredible story of survival was the inspiration of TNT movie called 14 Hours. Zachary was still in the NICU during the attacks of September 11, the day of so much uncertainty, and we had to leave the NICU once again without our baby. Soon after we went home, a nurse was asking me to the gloves that are in the unit. But there was a problem, in fact, many problems, and I could take a risk for my baby, but I could not take them for someone else. I found a way to pay my promise, and my company, Nurtured by Design, was born. I engineered what I call the ZACI, to be an evidence-based neuroprotective family integrated care system that connects parents with their babies, regardless of their size, medical condition, or developmental state. Our work and Zachary stories have been featured globally, and we have received numerous awards, and we are grateful for each one of them. Now let's talk about the womb. The womb is a perfect place, and it solves all babies' needs automatically. Babies feel loved, protected, and connected with the mom 24/7. A baby's sleep cycle lasts roughly 1 hour, and at 32 weeks gestation, a baby in the womb sleeps about 20 to 22 hours a day. How long do you think they sleep in the NICU? Not nearly that much. Preemies are born fighting to live, with a body that is not prepared to function in the conditions outside the womb. Lungs are not ready for air. Their muscles are not ready or strong enough for gravity. Their eyes are not ready for light, and their stomachs are not ready to process any food, but they have to use them anyway. They work hard to adapt to the equipment, interventions, and people that are trying to save their lives. But survival is not enough. There are many malformations and deficiencies that can be prevented in the NICU when the parents are involved. The most effective way to connect to your baby is holding them skin to skin. For me, kangaroo care was the opportunity to finish my pregnancy. For Zachary, it was a lifesaver, and maybe gave him a reason to survive, feeling the love of his family. Plus, there are a lot of benefits to the baby and the parents already documented in the kangaroo care literature. In the last 16 weeks of gestation, the brain grows 4 times. And it is not just about the size, but the networks and pathways that develop during sleep. Always remember that sleep is when the brain grows. Where is the best place for them to sleep? In kangaroo care. So hold your baby as long as you can. No less than 1 hour per session, which is 1 sleep cycle, and no more than 24 hours a day. What I mean with that, give as many sleep cycles as you possibly can. Who can hold skin to skin? Parents and anyone with a chest that has the parent's permission to do so. Others hold the baby during, using kangaroo care position, but keeping the clothes on. Remember, any chest is better than a mattress. You can kangaroo care during COVID-19 following the recommendations found at kangaroo.care and what Ashley said at the beginning of our presentation. Here are the products that I engineered to keep your baby and you connected. If you're together, use the Zaki Zak during kangaroo care, whether it's skin to skin or clothed. If you're apart, use the Zaki Hug, which is an extension of your touch. The Zaki Zak is a safety device for babies that are being held either clothed or in skin to skin contact. It wraps around the torso of the mom during the golden hours after delivery and C-section. Then anybody can use it at postpartum in any hospital unit caring for babies up to 15 pounds and then at home. It is designed for moms and dads to hold 1, 2, or 3 babies at the same time. It closes with an adjustable zipper that guarantees a perfect fit every time and a quiet and immediate access for breastfeeding, pumping, interventions, or transfers. Because the Zaki Zak is holding the weight and posture of the baby, parents can use their hands to keep their mind occupied so they can read or take a nap while being supervised by other adults and when our instructions are followed. There is a mountain of evidence about kangaroo care. These are clinical studies using specifically the Zaki Zak. They show significant improvement when using them in postpartum NICU and babies born with a heart disease. Another study in South Dakota found that they significantly increased kangaroo care duration, frequency, and parent satisfaction in the unit. When you're apart, use the Zaki Hug. Everybody can use a hug. When possible, send them by placing them in the chest or behind the neck for 1 hour during kangaroo care or all night like I did. One pair of the Zaki Hugs are used as positioners, nests, soothing aids, transitional aids, attachment and bonding aids, devices that provide containment, and because their environment remains predictable day after day, shift after shift, then they can be relaxed and sleep better, and sleep is when the brain grows. To follow back to sleep guidelines for babies ready to go home, the Zaki Hug provides the environment for the baby to fall asleep, and once they're sleeping, you can remove the Zaki Hugs. There are 2 publications that research the benefits of the Zaki Hug. Not surprisingly, the results showed significant improvement of self-regulation, decreased apnea and bradycardia because the babies are sleeping, and decreased pain indicators during vein puncture because they're relaxed. The Zaki products are accepted by hospitals globally, and if your NICU does not provide them, you can buy them in our website, thezaki.com, and bring them to your baby. This is my Zak now. He's finishing high school during this pandemic and will start studying engineering in the fall. Zak is our CIO, Chief Inspirational Officer, and I am grateful for every person that has touched his life because it made a difference. What I wish I had known is that I could have held Zachary in kangaroo care until he weighed 15 pounds. I also would have liked using the current design of the Zaki Hug and the Zaki Zak when he was in the NICU. Let me introduce you to Jenné Johns, MPH. She is the mother of a micro preemie. She's an author, advisor, and award-winning national thought leader in health equity. During her family's NICU journey, learned the power of advocacy, patience, and reading to her son. She's an advocate for reducing healthcare disparities. Jenné found herself advocating for the needs of her son and his survival depending on it. She authored Once Upon a Preemie, which is the only children's book written for the parents of preemies while they are in the NICU. This bedside companion seeks to motivate and inspire preemie babies and families until they go home. Jenné?
Thank you for that warm introduction, Yamile. And thank you to our sponsor at Prolacta Bioscience. And a special thank you to my preemie mom colleagues and advocates. Your presentations made me fall even more in love with you because of all of your dedication, passion, and leadership in the preemie parent space. I am honored to be here today to share a bit of what I've learned around the importance of reading and partnering as power in the NICU. 6 years ago, my son was born 14 weeks prematurely, weighing 1 pound, 15.3 ounces. And we entered the NICU and the roller coaster ride associated with being in the NICU. We had many unexpected highs, lows, twists, and turns. And as a result, we experienced this sea of emotions. And I, like many of the parents who have babies in the NICU during this COVID season, felt on many days shock, anger, disbelief, anxiety, and high levels of isolation. And I'd like you to know that during my son's NICU stay, nearly 3-month NICU stay, he was born in one of Philadelphia's worst snowstorms ever. And so there were days when I could not physically reach the NICU because of transportation barriers or weather limitations. And I felt that isolation even deeper and even stronger on those days. I know that your experience, if you have a baby in the NICU right now, those feelings of isolation may only be magnified at this time. But I'd like to share with you that there are strategies and ways that my colleagues have already shared and that I'd like to share with you that you can do even if you're apart from your baby right now. During our nearly 3-month stay, I yearned for any and every opportunity to just feel like a normal mom. I wanted to do something with my son that didn't require medical intervention, a breathing tube, a feeding tube, or a professional to watch or administer what I did with him. And one of the nurses in the NICU who I had a good relationship with suggested that I simply read to my son. And this was something that I could do with him whether he was in the isolette, during kangaroo care, or once he moved to an open crib. When I researched what reading could do for babies and preemie babies, I was excited to learn that research studies indicate that reading to a full-term baby stimulates healthy brain growth and development and encourages parent and child bonding. And these impacts are only magnified for preemie babies. So I was sold. I started reading to my son daily. And before I knew it, he had the tallest library of books stacked up in the NICU by his isolette. So much so that we could loan books out to other parents. This was a wonderful opportunity for us to connect. And this was an excellent opportunity for me to do something with my son one-on-one that helped to normalize this very abnormal experience. I'd like to encourage and suggest to the preemie parents on this webinar who have babies in the NICU at this time, if there is a way that you could record yourself reading a book, that you share that recording with a NICU nurse so that the baby can hear your voice even if you're away from them. When we were reading books to my son, we read many wonderful lullabies. They were all beautifully written and beautifully illustrated, but I grew frustrated because none of the books reflected or represented our unique NICU journey and experience. As you know, many children's books and lullabies are written where a mom and a dad tucks the baby into bed at night, they turn the light out and they kiss the baby goodnight. And that was not our experience for a very long time. And so I felt very disconnected and hurt when I read a lot of those lullabies. And so 1 month after my son's discharge from the NICU, I started to journal as a way to process and digest and unpack that NICU roller coaster ride we were just on for 3 months. It was the first time in a very long time that I heard silence and not the NICU bells, dings, chimes, etc., or even my son's monitor alerting. And in that process of journaling, I wrote many poems to my son, and it was very therapeutic for me. And one of those poems that I wrote to my son ultimately became Once Upon a Preemie, which is a beautiful new way to look at the life of a preemie baby. And at the time that I published in 2016, it was the first and only children's book written for preemie babies still in the NICU as a bedside companion. There are other wonderful books on the market now, but at that time, we were the first. And so we encourage you to make Once Upon a Preemie available to the preemie baby and or preemie families in your life because it is very powerful. In addition to publishing Once Upon a Preemie, I've had the unique opportunity and pleasure of writing several other publications and materials to support preemie parents when they're bedside with their baby in the NICU and beyond. Many times, and after a while, I would just read anything to my son. And I know it worked because he's 6 years old now, completing kindergarten. And one thing that we still love to cuddle up and do at night is read books to one another. And he's reading to me now. But these resources are available to you, and we welcome and encourage you to read them as a comfort and support to you and or the preemie families in your life. In addition to learning the power of reading to my baby in the NICU, I also learned the extraordinary power of partnering in the NICU. I'm going to admit, when my son was in the NICU, I was one of few African American families in the NICU, and when I looked around the NICU staff, although many of them were wonderful, we were not culturally matched. And so upon entry in the NICU, I brought some implicit biases. I certainly know from my professional background, there were some implicit biases placed on us unnecessarily that made a true partnership, true trust and respect and open communication difficult initially. However, once I had a few very tough, candid conversations with the director of nursing in the NICU and the chief of neonatology, we were able to dispel some of our cultural biases and stereotypes together to form very strong partnerships and alliances. At the end of the day, my vision and goal was to be my son's best advocate because I knew his life depended on it. But how could I be his best advocate if I couldn't spend the night with him? If there were days that I couldn't get to the NICU because of weather or transportation limitations? And it became very difficult, to be honest, leaving him in a NICU where I didn't always feel like I trusted the staff that he was surrounded by. Nor did I always feel that my voice as a mother was heard or respected. And so I encourage you, if you have a preemie baby in the NICU at this time, especially in this COVID season, to just find one. Just find one staff member in the NICU who you can trust and pick up the phone and call no matter the day or time to check on your baby's status or to send a message from you or your family to your baby. They will appreciate hearing from you and they will appreciate the respect that you have for them. We are excited to announce that this November, Once Upon a Preemie will be launching the first of its kind, Once Upon a Preemie Academy, which is a virtual training program for NICU professionals and preemie parents. Our topics will exclusively cover diversity, inclusion, culture, and health equity pre, during, and post the NICU. Please feel free to visit our website to join our listserv to learn more information. And we're excited to launch in November because, as we all know, we all go purple for Prematurity Awareness Month. And lastly, what I wish I had known when I was in the NICU, I believe I've captured in the middle of my book. I'm just going to take a moment to read what it says here because I hope it brings value to your experience in the NICU currently. And that is, your life is not by accident, and blessing us early was not a mistaken arrival. It was just a mere glimpse of your future and of your special gift called survival. I believe that preemie babies are absolutely survivors. And we as preemie parents are also survivors. But the thing I'd like to impart and share with you today is that that cape that's on that flower does not leave once you are discharged from the NICU. You will continue to use that superpower cape, and so will your baby, so that your baby can continue to survive and thrive into adulthood and beyond. And now I'd like to transition the call back to my colleague, Ashley, who will provide a summary of our presentation.
Thank you, Jenné. Thank you so much. Now, to summarize what we have learned today, remember, there is no evidence of COVID-19 in breast milk. You knew before anyone else, your input matters. We need to feel love to thrive. Babies are no different. Reading is power and love. Every day, give your baby the gift of reading. I thank all of our presenters for the wonderful information they shared today. Before we start our questions and answers segment, I would like to invite Carolyn Tenek from Proactive Bioscience to say a few words.
We just wanted to take just a moment to thank our guests and our awesome speakers today. You've heard from Mrs. California. You've heard from CEOs, authors, creators, innovators, advocates, and of course, all fantastic moms. When we first began to talk about this and comprehend the increased anxiety and isolation that NICU parents are feeling due to the pandemic nationwide, these ladies did not hesitate to spring into action, to start working together on this months ago, to plan a very meaningful strategy to try to help others. And what they've shared is from their heart and from their own professional experience as preemie moms and leaders, both at their local level in their own communities, and of course, as you've heard, nationally. Prolacta has been very privileged to partner with them on a number of initiatives, and especially now during this pandemic with them. And what we hope is that you all will share this with others, the content, the resources. We simply ask that you pass it on. Thank you very much.
Thank you, Carolyn, so much for all that you and Proactive Bioscience do. We will go ahead and take some time for questions. Just a reminder, please be sure to type your questions into the question box in your control panel. We will get to as many as we can. I will wait about 2 minutes before we will begin answering questions. I will go ahead and I do have two questions that came in from registration. One question for Deb. How do you feel about telehealth support during COVID-19 right now?
I think it's crucial. I think telehealth is surging right now. It was in its infancy before now, but definitely is taking off. And I have found that every kind of healthcare has benefited in this way. I know a colleague of mine that runs NICUhealing.com. She's a therapist and a family and marriage therapist, and she does everything virtually, and it helps families, especially ones who are on lockdown, helps them through this time without having to go drive somewhere or anything like that. So I think it's important. I think we're going to continue to see it surge. I think it's going to improve more and more. Thank you.
Thank you so much, Deb. The next question I have is for Yamile. What are you hearing from families around the NICU in terms of their ability to do kangaroo care?
So that's a good question because we have, depending on the NICU, everybody's doing different things. The WHO recommends that if the parent is not suspected or confirmed as having COVID-19, the parents should go through the same screening as the staff to be able to come in the NICU. And there are some hospitals that are allowing one parent at a time. Sometimes they allow only 15 minutes at a time. It is very disheartening to see that many hospitals, for no apparent reason, decide that everybody just doesn't kangaroo care. But now, I think after Kangaroo Care Day, which was May 15, there was more conversations about the importance of parents and 40 years of research about the importance of the parents to the well-being and quality of life of the babies. So more and more are allowing skin to skin with many restrictions. Some of them don't have restrictions at all. They have they come in. They can have both parents. They can have kangaroo care. Some have restrictions of one parent at a time. Some have restrictions of how many times you can come in. In countries like Iran, which there is a lot of COVID everywhere, they don't even allow the parents to come in, not even for breastfeeding. So it is all over the place, unfortunately. But the science doesn't lie. The science shows that parents need to be with the babies and give them an opportunity to survive.
Thank you so much for that. That was very informative. Thank you, thank you, thank you. We have time for one more question. This will be to Jenné. Is your book available as an ebook currently?
Thank you for that question. It's a wonderful question. We are not available as an ebook at this time, but Once Upon a Preemie is a very short and compact book that's perfect to fit into the Preemie Parents NICU bag.
Thank you for that. That's good to know. Thank you. Well, it looks like we've covered all of our questions that we have time for today. Presenters, is there anything else you wanted to cover before we wrap up today?
This is Yamile. I just wanted to thank everyone. Thank also Prolacta and Ashley for inviting us, Deb and Jenné. This has been a really interesting time of preparation, and I love working with you. If anybody has any questions, our websites are on the bottom of the page, and you can contact us at any time.
And this is Deb. I also want to say thank you to the team. You guys are awesome. And Carolyn, thank you for proactive support with us. That was wonderful. Thank you everyone for attending. We really appreciate it.
This is Jenné. I'd also like to thank all of the attendees for carving time out of your busy schedule to join us today. We'd love to keep the conversation going. As Yamile said, all of our contact information is under our names on this slide. We'd love to hear from you. Please let us know what you're experiencing as a preemie parent or the parents that you're supporting as an advocate or an organizational leader. We'd love to be a resource to you and your community in some capacity. Thank you.
Great, you guys. Thank you, everyone. We appreciate you being here. You can find more information about our speakers from today on our www.preemiemeetings.com. You can also find it right here at the bottom of the slide to find their direct website. We thank you again for joining us today, and we will see you next time.